Thank you, and welcome everybody. Welcome. I'm going to do what staff does. Welcome. Thank you, County Manager, Chair, Vice Chair, Commissioners, and staff. Seriously though, thank you, and thank you for this. I'm kind of excited about talking about my passion. First, I'm doing behavioral health. I'm presenting on mental health or behavioral health, many words for it. But I'm passionate about this, and I know some of you have heard this, but, and I won't tell his story because that is his story to tell. I will tell my side of the story. When my son was 17, we had some serious challenges, and it got to the point of desperation. And I think that if you're a parent, even if you have a 3-year-old who's skinned her knee, when your child hurts, you hurt. When your child is in trouble, you feel in trouble and you feel desperate and you want to do whatever you can to help that child. And I'm no different. And I'll never forget, I sat at the kitchen counter trying to figure out what I could do, what our resources were, where would I go, and I started with the county. I went on the county website. Honestly, at the time, it confused me. It made me a little more upset, and really all I could think about is what if I didn't have the resources for my child? What would happen? And that just led into a journey of finding out about mental health in the county, what I could do with somebody who had resources, who had insurance, which didn't cover everything, as you probably all know. Our insurance needs reform. But that is how I got to this point. And in 2020, when I was tapped to run for this seat, mental health was a big driver for me. So that's where I am now, and this is why I am here talking to you about behavioral health. First of all, I would love to thank Dr. Penn, number one, for being here. You will be called on, and she's been a great guide, and she really got me out of the weeds. I really started to get too detailed with things, and so she kind of brought me down to helping me narrow it down, so thank you. So right now, there's probably more awareness over mental health than ever before. Our children, the generation growing up now is dealing with things that we did not have to deal with, mass shootings in their own schools, social media causing depression and anxiety, and never before have we talked about it this much, and that's a good thing. Anxiety has always been there, depression's always been there, mental health issues have always been there, but we're talking about it more than ever before, and that's a good thing. And so before I talk about, well, first of all, my objective today is for you all to gain an understanding of behavioral health and the funding in North Carolina. We are, after all, a funding body, and we fund partly mental health. So I want to explain to you how we got here and gain an understanding of why we need to continue funding mental health in Mecklenburg County. So over the years, and I'm going to talk about how we got here first. You have to understand how you got here before you can move forward. I'm a history teacher. So I want to start with where we start with the beginning. And mental health used to be people were possessed with demons. They were taken out of society. They were put away, didn't want to think about it, didn't want to even talk about it. And as time moved on, we had heroes like Dorothea Dix in North Carolina. She started a hospital, Broughton Hospital in Western North Carolina, and those were asylums, mental health hospitals, and they were treated away from society. And that was a good thing until it wasn't a good thing. And as time went on, and this is not on the slide, but in 1963, President Kennedy he proposed a landmark Community Mental Health Centers Act. It eventually passed, and by 1970, community health centers were serving 68% of North Carolinians seeking services in mental health. And so from the 1970s to 2000, North Carolina counties deliver behavioral health services and managed state and Medicaid funding. And warning, we're going to be talking a lot about Medicaid from here on out. From 2001 to 2014, North Carolina passed the Mental Health Reform Act, and it was aiming to reduce the number of entities managing state and Medicaid funds and services. And so we gradually went away from, they were finding situations of fraud where the providers were committing fraud because they were being paid for their services and the services really weren't happening. So as time went on, after several years of controversy, we got to, we went from managing and doing it ourselves to hiring, contracting out Cardinal Innovations, if you guys remember. I know most of you do. And then from Cardinal, we shifted to Alliance Health, which is who we are with now. LMECIO, am I saying that correct? I'm terrible at the, say it again. LMECIO. Yes. The state began to move to managed care, which is where we are now, further broadening Medicaid funds disbursement. And so 5 insurance companies started administering Medicaid, including Blue Cross Blue Shield was one of them, and Medicaid expansion took place here in North Carolina. So right now, Alliance is helping administer Medicaid and state funding for the uninsured and those who are underinsured for severe mental health services or behavioral health needs. They also administer federal block grant. We can get in the weeds. It's way more complicated than I ever thought. And so this deep dive for me has been quite enlightening. And I certainly am not the expert. So if you have questions about how we got to where we are, that is where I'm going to actually definitely have staff come help. So the takeaway of the history is I just want you to see in the past 25 years, North Carolina's management of behavioral health services and funding for low-income and underinsured residents has changed dramatically. With it, that role counties has, our role as counties across North Carolina has also changed. So currently, supporting residents access behavioral health services is technically a state and managed care, versus, example, Alliance, responsibility only. But if that is the case, then why does the county invest so much money and why? So now I want to get into access to services in Mecklenburg County. Residents with private insurance or Medicare, 75% of county residents had private Medicare in 2023 or military insurance. And this is a 4% increase from 2015. And if you can see the chart, this is the annual out-of-pocket spending for insured individuals. For example, when I was looking for my own son, we had to use our own insurance. Insurance kicked in a little bit, but the majority, we had to spend out-of-pocket. Most people cannot do that. So as you see, for severe depression, $1,930 was the annual out-of-pocket. That's just an example of what our residents are having to spend. Now, residents with Medicaid insurance, 347,000 residents are enrolled. Out of that, with the Medicaid expansion, 84,832 residents were enrolled when we expanded Medicaid in North Carolina. Now, when or if, because we don't know what's going to happen with the federal cuts, if it happens the way we're being told it's going to happen, at least 84,832 people will be without insurance in North Carolina. I'm hoping that's not the case, but it could be more. It could be less. We don't know. There's just a big question mark right now. So something about Medicaid I think is interesting. There are no copays, but low reimbursement rates make serving people with Medicaid less attractive for clinicians. And I just want to repeat that. Physicians don't necessarily want to use Medicaid because it's slow to reimburse and they don't get reimbursed for the full amount. And I think that is extremely important for you to understand and disturbing as well, because that means people won't seek health access, they won't seek mental health help because they don't have the money to pay. So as of October 1st, the state cut reimbursement rates by 3 to 8% for many behavioral health services, placing greater strain on providers who accept Medicaid, which you just heard is not working. Residents with no insurance. Over 130,000 of us in Mecklenburg County have no insurance. That means they're not seeking help. They're not seeking mental health help. And if they do, they go to the emergency room. So limited access to care can use county-funded services, and if the behavioral needs get bad enough, then they could possibly access state-funded services through Alliance. And once again, which we keep hearing, undocumented persons cannot access care through Medicaid or state funding. I just want that out there because it is an untruth that's been told at the federal level. Medicaid does not cover undocumented individuals. So the takeaway of this, Medicaid, as cuts loom at the federal level, with the passage of that budget, which I won't use the name, less of our residents will be enrolled in health insurance and in a health insurance plan, whether it's Medicaid or even their own. The burden of treating the uninsured will fall on Mecklenburg County, including behavioral health access. And that's where we're moving forward here, is the burden is going to fall on Mecklenburg County. So how are we doing in Mecklenburg County? And I have to say, we support mental health in Mecklenburg County. I commend this county, I commend our staff for making it a priority. So, and I do definitely want to call out public health and who we contract out with, like say Camino or Charlotte Health Clinic. They provide mental health services too, and our money is also going to those. So, in Mecklenburg County, the leading causes of death, suicide is number 9 in Mecklenburg County. Among our children, ages 15 to 24, it's the 3rd leading cause of death. Suicide is the 3rd leading cause of death among our children. From 25 to 44, suicide is also the leading cause of death. So, from ages 15 to 44 years old, suicide is the leading cause of death, is the 3rd leading cause of death. That is a sobering number. Youth behavioral health. I don't want to focus just on youth, but I definitely think it's worth giving you the numbers of our youth in Mecklenburg County. And I'm not going to read it for you, but substance abuse is a huge factor in our youth right now. If you look at, let's look at 2021, which was the last numbers that we could get. In Mecklenburg County, 17% of our youth had at least one alcoholic drink or more in the past 30 days, and they used marijuana 1 or more times in the past 30 days at 13%. And our psychological health, teens are ever attempted suicide or tried to kill themselves. In Mecklenburg County, 9% in 2021, and which is just below the state average at 10% and the national average. In Myers Park High School alone, in a span of 2 years, 4 of our kids in Myers Park High School committed suicide. 4. And I'll tell you, when I was growing up, I knew no one who committed suicide. In all my 4 years of high school, we didn't talk about mental health. It was never at the forefront of our discussion, and I never had to deal with a suicide. That could be different for you, but I can only think about myself. My own children saw suicide in school, and this really no surprise, considering this generation is dealing with mass shootings, school shootings, social media, which has been known to cause depression and anxiety. This is something that we've never had to deal with, so it is kind of new. But I just wanted to bring that up about the youth. It's not all about youth, but we do need to take care of our children. And it being in the forefront, we became national news recently with the incident on the train, and this was an individual who had an undiagnosed mental health issue an untreated mental health issue. And if you think if we could have caught that person early on and treated that person early on when they were a youth, how different things would be right now. So just some trivia about substance abuse. Overdose deaths among Black and Hispanic residents in Mecklenburg County have increased by 20% since 2019, compared to a 15% increase among white residents. Fentanyl, contamination in cocaine, and counterfeit pills is a major contributing factor to these disparities. Our homeless population, I don't know the percentage. I wish I knew the percentage. Somebody might be able to help me. Are addicted to some form of substance. And if we could treat these people who want to be treated, things could be completely different. So general mental health in Mecklenburg County, how are we doing in Mecklenburg County? And as you can see, we're worsening. And I think some of us actually saw this slide maybe last year. So suicides at a rate per 100,000, our goal is 8.6, but as of 2023, it's 11.0. So 11 people per 100,000 people in our county have committed suicide. Youth suicide attempts, our goal is 185 per 100,000. This is just attempts. But as of 2023, we are at 205. We are moving up. This is one number you don't want to see move up. I won't go through all of them. You can see for yourself. But right now, our kids are not okay. Our residents are not okay. And we need to treat them the way they need to be treated. So the takeaway is, as the mental health of our residents is worsening, coupled with even more of our residents predicted to be uninsured, I want to repeat that. Coupled with even more of our residents predicted to be uninsured, Mecklenburg County is facing tough funding decisions around behavioral health. So what are we doing? How do we supplement? And this can get kind of, it does get kind of complicated, and I'll try to get through it. So these are our service types. This is what we're doing. As you can see on the left-hand side, the department, let's just say Child and Family and Adult Services. The service type is behavioral health contracts for community-based services. I'm thinking Care Ring, Charlotte Community Health, Camino, and that's at $13 million. So total, what we have funded is $23 million, but the actual total cost was $23,619, but we paid $23,479. And my point is, we're paying a lot in mental health. Our state is not paying like they used to. We are having to make up more than we have in the past. These are our county-funded programs. Again, I'm not going to go through all of them. Just to be clear, this is 2025. There are some on here that we don't fund right now. Hopefully, we'll go back to it, like, for example, Sid Kimmel. But these are some of the things that we are paying for now. We're also paying for the Steve Smith BHUC. We help contribute to the capital needs, but also it's a braided plan where Alliance contributes, we contribute, and Medicaid contributes. What Medicaid and Alliance does not cover, the county will kick in, and that's called gap funding. And so, correct me if I'm wrong, right now we have a contract with the BHUC for $750,000 a year. We will provide gap funding up to $750,000 a year. That's on top of what we paid for the capital needs. And so right now I don't think we've gotten to $750,000. You're nodding. And so that's called a braided, that's braided funding, and it can get complicated, but that is what we're spending on just to BHUC alone. That is obviously a mental health urgent care. So it's imperative that the county continue to provide funding for behavioral health services, particularly for those who are underinsured and uninsured, allowing our most vulnerable residents access to critical prevention and intervention services. As we continue to support services for individuals, we are in turn supporting their families, we're in turn supporting their neighbors, and the community at large. When we help our residents, we're helping the community at large. It affects everybody. And as Chair Jarrell started yesterday, he said, if you don't have a place to live, what do you have? And I can argue that with mental health. I can argue that with green space. I can argue that with anything. If you don't have your mental health, what do you have? How can you make it through a day? If you have help, though, if you have resources, if our children know that they're cared for and they have help, they have support, we can make it through the day. And I believe that is it.
All right, thank you. Of course. Madam Clerk, we're going to try and set the timer at 2 minutes. Obviously, I'm going to give some flexibility, but that's just to keep us on track. So we'll start, so I'm asking colleagues to please be mindful. We'll start with Commissioner Townsend Ingram. We're going to work left and go right.
Thank you, Mr. Chair. The mic's not on. Thank you. So I want to thank my colleague on the County Commission because Chair Jarrell knows that this is an issue that's really close to my heart, but I don't think that most people do. And I didn't know that you were as passionate about mental health care as you did. And I didn't choose this as my topic because I am too close to it. But I appreciate you providing all of the information that you provided because there's a lot of stuff that I didn't know with regard to your presentation. One thing a quote that I often use is contributed to Frederick Douglass is, it's better to build strong children than to fix a broken man. It's much easier to do that. So programs like Sid Kimmel and all of those others, again, applying the rules of, making sure that they're on target and servicing the people that they need to service, I absolutely think we have to invest more in, especially considering now Medicaid is at risk of going away. My son and your son, it sounds like, there's some similarities there that we probably could talk about and I could use your help with. My question is, how do we do the appropriate level of advocacy? Where do we put that advocacy? How do we work with the North Carolina General Assembly? Because everything is being pushed down to the states. So how do we appropriately advocate for particularly our kids and start there with the hopes of it, those services spreading out to additional people who need it? Because I can tell you there is also a cultural component because Black people are like prayed away. That's the first thing that's stated. And there's a stigma still that's attached to seeking help. So how do we advocate?
Thank you for that question. I think it's always a big question on how do we advocate, and I would love for Lizette maybe to suggest, if we're talking about the North Carolina General Assembly, I'm going to have to refer to Lizette Nimmons.
Well, so is this on?
It is.
Okay. So, of course, I'll first refer you to our legislative agenda. So this is one of the high-level items. So what we do in general is if there's something related to our legislative agenda that we see come through the General Assembly, we will advocate, we will support or oppose. I lean on my colleagues from HHS a lot. If I have questions, I go to them, and then we are able to formulate a response or make suggestions to members of our delegation on how we want to see them vote on a particular matter. So that's one way. And then there are always opportunities when we have our one-on-one meetings with members of delegation to share certain things. And again, through some of our annual events, you notice we have specific items that we'll discuss with them. So for me, that is the start of this advocacy. So.
And Dr. Penn, do you want to add anything? Come share. Come up here. It's fine. Okay. This is not off my table.
It's not.
The walking up, it's not on me.
Reclaiming your
My
time.
fault,
Is that
she
what
was
you're
slow.
doing?
Good morning. The only thing that I would add is that part of what I think, Commissioner Townsend Ingram, you hinted towards the issue of stigma within our community, and both within communities of color, but in general around mental health as well. But what I will share is that stigma is decreasing as we get down into the younger generations. But we are still in a state where youth who may be 15, 16, 17 years old cannot independently seek mental health services without parent permission. And so that is another thing that we need to think about from a legislative lens is, should we consider advocacy not just directly for mental health, but also for access to care for younger people? And how do younger people access care when they're saying, I'm depressed and I need this, but the parent is saying, not on my watch, pray it away.
Let me move to Commissioner Leak.
Let me first say thank you, and I can empathize with you to some degree. Black boys have always been labeled as being unstable. When they started the school, I can recall my first year teaching, early teaching, Ritalin was given to black boys and not anybody else. First thing the teacher said, because you're up out of your seat and moving around, you got a problem. But this was never looked upon of other races. And I'm appalled at the number of young people committing suicide today versus years ago, because black folk didn't kill themselves. Well, the record did not show. And now we are getting that information, but we do not outnumber. When they closed the mental hospitals years ago, maybe 25 years ago, I used to take my psychology classes to Morganton to visit those facilities. And when we discovered there were many of our residents there in Morganton in those facilities, we stopped going. Parents did not want their children to be confronted with this behavior or what have you. So I'm saying to this community and to all of us, there's a little bit of weakness in all of us when it comes to mental capacity. You may be strong in one way and you may not be strong in another. So that's a major concern that we have to deal with. And when it comes to drugs and what have you, in my district, I go to a community, used to go every 2 weeks. I've become so concerned that I go every week. I can't do anything to impact that process. The bill stopped me. And I wish the bill could stop.
Finish your thought, Commissioner Leak.
Yes. I can't do anything to stop it. We've talked, we've met. We need to make sure that we come up with some form of action that's going to eradicate some of these problems. Parents, community. So I'm only saying to us, lobby with our legislators, lobby with us, to lobby with Washington and with Raleigh, to reestablish those institutions, those facilities. You drive along out here, we're just coming up here,
Commissioner.
I'll stop.
Thank you very much.
And I don't want to go off because you say I'm crazy.
So
I appreciate that.
I just want to say to that, thank you, Commissioner Leak. Advocating with the government is great. I think more education for parents is also necessary. I know that when the county did the 2 mental health forums in my district, they were well attended. People want to know. They want to hear what the resources are. They want to hear what the action is going to be. So I do appreciate that.
Commissioner Griffin.
Thank you. Thank you for your presentation. This is certainly an important topic, and I'm trying to figure out how we can improve the performance within Mecklenburg County. Certainly the big topics of ED visits, suicides, I mean, those things are sort of the big ones. But how do you sort of frame or categorize challenges with ADLs? And then what's the response in terms of ADLs? And that's something I'm struggling to try to get my arms around. But that's really important because that's also like a prelude to emergency rooms if you don't get your arms around the ADL piece. Can you help me with any examples or things we could do better around the ADLs so that we don't get to the emergency rooms and other situations?
In jail.
And jail, yeah.
In jail.
In jail.
And ADLs, just for everybody, is activities of daily living. And so I think, Commissioner Griffin, please correct me if I'm wrong, but what you're speaking to is folks being able to maintain full participation in a quality of life that we expect to have as individuals, but that we'd like to see our neighbors have as well. And the relationship between poor quality of life and poor mental health outcomes, is that fair to say? And so part of what we've started, well, and I think my division has done this for a long time, but as Commissioner Meier's presentation shows, we contract for quite a few behavioral health services. And while due to matters of confidentiality and in some regard technology, we don't have yet a great capacity to measure outcomes directly related to behavioral health, what we do ask all of our vendors to provide us is information about social determinants of health and how folks who are participating in county-funded behavioral health services, how they're doing relative to social determinants of health, such as do they have access to transportation, do they have access, and are they participating in work or education activities, things like that. And so we are looking at that right now, but and you and I have had this conversation, but we are very interested in getting to a place where we can understand how folks' quality of life is different as a result of receiving behavioral health services that are county funded. So that is the horizon for us, and we'd like to see that tied into value-based care. How much do you get paid for your contract based on how folks are doing? We're not there yet, but that is what I'd like to see as a future state.
Thank you very much. My time's up.
All right.
Thank you. I'll talk quickly because I am sensitive to the next presentation that we want to get to. But I want to thank you for the presentation. I don't think we can spend enough time trying to explain to the community why the system is breaking down, where it's breaking down, because they need to understand that to know how to fix it. Because unfortunately, as you've said, Mecklenburg County does not have the financial bandwidth to do right by this issue for the full community. I say that as a former attorney for at-risk children. I had child clients who had multiple month-long stays in hospitals their bills were like well over $100,000 each time. I've had a family member in the state of Maryland who had multiple months-long stays that the government ultimately ended up picking up because, very few people at any level of income can afford what healthcare costs when it is catastrophic. And as a society, we need to put things in place that protect all of us from catastrophes of this sort, from health crises that are catastrophic financially and otherwise. I just want to validate Commissioner Leek. I grew up in the 80s, and yes, Ritalin was prescribed to all kinds of kids who just may have had wiggles in their tushies or, needed to, maybe they were physical learners and needed to move around to learn. And that was a terrible disservice to all of our youth. And I also appreciate you saying that when you said there's a little bit of weakness in all of us, I remember someone once saying to me, none of us is as strong as we pretend to be. So it's just important to level set that so that we can just be more open to each other and support each other. So thank you for the time and the presentation.
Thank you, Commissioner Dunlap.
First of all, a little history that most of you probably don't know. We had Piedmont Behavioral Health, then the county had its own, and then we went to Cardinal. some backstabbing went on, but we went to Cardinal, and then we end up with Alliance. And so part of that question is, I'm still confused as to what we pay versus what Alliance pay when it comes to treating mental health. Because when I look at this, and I don't know the number on the slide, it says 23,300.
23 million.
Million.
Oh, I thought I heard her say 23,000.
She said that, but it's
She
million.
did say 1,000. Okay, well, I'm repeating what she said rather than looking. Okay, all right.
23,301,000.
Thank you for that correction, because I'm like, that doesn't make sense to me. But, so, when we look at the new Taylor plan, where is the difference? Because the Taylor plan deals with those that are the worst of the worst. Are our mental health patients under the Taylor plan, or are they under,
Standard.
yeah, standard?
So there are criteria that designate one as being eligible for the tailored plan. So theoretically, a person would start, if a person has Medicaid, you're either going to be on the standard plan or the tailored plan. It is folks who have more severe behavioral health, substance use, and IDD needs, intellectual and developmental disability related needs, that would be assigned to the standard plan. So in meeting with, to the tailored plan. Meeting with the standard plan providers, one of the things that they've clarified is that after so many behavioral health related ER visits, or after so many inpatient stays, then one would be transferred to the tailored plan.
It's so complicated. It's just
So
complicated.
one final question, Mr. Chair. Given the fact that only county dollars can support immigrants who are not documented, how are we dealing with that? Because they have mental health issues too. And if we don't treat the issues, it becomes a problem for the entire community. So what are we doing to address that?
That's a good point.
Yeah. So part of what is covered under that $13 million figure that you see there, some of those contracts are specifically assigned to vendors who provide services to a large percentage of immigrants, undocumented or otherwise, within our community. And so we do have contracted services in place that meet those needs, or that are available to meet those needs on the behavioral health side. And I'm guessing Dr. Washington would say the same on the physical health side.
So one final
There we go.
comment, please, it's all connected.
I'm sure it's connected for everybody, George.
No.
What other
Thank
thing?
you.
Okay, no, seriously. We have learned recently through the news how vendors get paid for services that they don't provide. We recently heard of a vendor that billed for $14 million, got $9 million, and you see what happened to the people that he was supposed to care for. The question is, what accountability measures do we put in place to ensure that the funds we pay for mental health services are actually used to improve a person's state of health?
Yes. And I'll give a short answer.
Please.
We do have a provider monitoring process that includes on-site visits with our mental health vendors, both looking at their documentation as well as collecting feedback from those who show up on their paperwork as receiving services.
Thank you. Commissioner Powell.
Thank you, Mr. Chair.
Yes, sir.
Thank you. No question.
Commissioner Rodriguez-McDowell.
So I want to ask a little teeny question of the manager, and that is, or whoever wants to answer, for the 23 million is, that's county funding, how much of that, is this part of the number that Adrian gives us when we talk about void of state funding?
Yeah, I believe we do include the behavioral health in it.
Okay, so if we had a state that was prioritizing mental health, we would assume that this 23 million would be paid through the state funding,
State, federal government, yes.
state and federal. Okay, thank you. Thank you for the presentation. I think it was fantastic, Laura.
Thank you for the presentation and the information. This is just for staff in general. I've got some questions. I don't want them answered now. I just want follow-up on this, and I'd like it to go to the whole board. First, I want to get a number on what our total contribution to Alliance is on a yearly basis. Also want to know how many people do they serve versus what we understand to be the community need. And again, when we talk about Alliance, they have a provider network, right? So there's independent practitioners and providers that are in their network. So when we're looking at that, however we have to slice and dice that, they have X number of providers, the capacity to serve in these particular categories is this, but we know that the need in the community is Y. From what we can anticipate. The other thing is, in your presentation, Commissioner, you referenced 130,000 uninsured or underinsured. I think that's a combination of both. What I'd like the board to get an understanding of is, I'll come back to you in 1 second, Commissioner. Deb, I got you. What I want to understand is this, and I want the board and the community to understand, when we talk about the uninsured, underinsured, 130,000, with our current funding partners who we fund, what's that capacity? Like how many, like CareRing to me is one of our biggest funders that move in that space. I want to know how many people they have the capacity to serve. I want to understand how we're reaching this 130. Do we have the people identified, or we're just, the math tells us that? And what we're doing to reach those underinsured, and how many additional partners do we really need to be able to cut into that number to the extent that we can? So I'm just really curious about capacity issues, the numbers, our reach. And so I just like I'll come to you in 1 second. Let me go to Leak first, and I'll come back to you. Just want us to get hopefully, and then if we have to go offline for me to clarify any of those points, I'm happy to do it.
I just want to say to that, those who are uninsured and underinsured are less likely to seek services. So it's hard to know who they are unless they come looking for help, whether it's physical health or mental health.
Okay. And that's fair, but there's got to be a way. No, thank you for that. Thank you for that. So let me give a minute to Commissioner Leak, and then I know Commissioner Griffin had something else as well.
I was listening to Mr. School Board Chairperson. We experienced a teacher and a principal who lost her life at South Mecklenburg High School due to the very thing we're talking about. And it has stayed with us. If we drive in any area where there's drug abuse, there's mental health. So this community is infested in the Black community. We're not responding to it. We're not helping it. We talk about it, but we're not doing anything about it. And that worries me that this community, meaning the city, have a responsibility. They're not. And I'm just awfully disturbed when we talk about mental health in our community. I'm seeing young women, young girls, 15, 16 years of age, who strung out on drugs. But that's not the real reason they're there. So we have some problems.
Thank you. Commissioner Griffin.
Yeah, mine's real quick, just to add to the chair. Last December, we gave Alliance Health $5 million without any strings. So we just add all the numbers together. Thank you.
Thank you for that. Thank you for that
Thank you.
presentation, Commissioner.
Thank you.